Hello, my name is Paulina Krasik, and this is my Nursing 335 clinical reflection video. So the purpose of this video is to explain how I met my 8 objectives in the course. So the first objective is to utilize previous knowledge of sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. So the way I did this was through my peer leadership in Nursing 311. So I helped these students take their vitals, so I had to utilize my knowledge from 309 skills. I also was able to use the skill for my independent when I did the Skills USA. I was a judge for vital signs. So in order to be the judge, I had to understand how it should be done, the process, and to be able to judge the students. I also utilized this in peer leadership for Mom Baby, Nursing 320. I realized that although I took this class last semester, I needed to refresh myself with certain topics to help the students and utilize that information. So the second clinical objective is apply basic principles of management to meet challenge of an ever-changing healthcare environment. So the way I did this was I was able to manage the times. I managed to make sure that they don't overlap. I set up my advanced practice. I coordinated with the healthcare providers and their availability. I also was able to be flexible when the Skills USA kept getting canceled due to weather inclement. So that just gives you an idea, because with healthcare, it's always changing. There's always people calling off. There's always weather inclements, personal reasons. So you always have to be flexible, and you still have an objective to fulfill, and you still need to get the job done. So that's how it translates. So the third clinical objective is demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. So the way I did this was in the community. I was able to use my leadership and teach people about blood pressures. So we had a session for employees at Cedar Crest College where they would come in, get their blood pressure checked, and then they would kind of ask questions about their blood pressures. So I was able to teach them and use my leadership skills on that. I also use this in the continuing education for the new organization, Multicultural Nursing Student Organization. When we would plan to set up meeting times, we would sit down all together as a group to decide how can we attract more people, when would be a good time to schedule our meetings so more people can come, how broad do we want this organization to be. So for the fourth clinical objective, it is critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. So my experience with this would probably be patient logistics. So with leadership, we know there comes conflict. And a lot of the conflict that came with patient logistics was interpersonal. So I apologize. I meant to say with leadership comes negotiation. And some negotiations that are involved with this was collaboration. So the patient logistics people were responsible for bed management. So they would get phone calls from various hospitals. They could get 911 phone calls, and they needed to place beds into the ER. And from the ER, they would need to place people into beds within the hospital, in-house they call it, or they would need to discharge them in order to have sufficient enough beds. So this affects the healthcare system because we need enough beds to meet all the people's care and be able to have a greater volume to provide the care and be taking in more people from different places. So the fifth clinical objective was function as a competent patient advocate, nurse advocate, and change agent. So I think my best example for this would be the interprofessional. So I was at Lutheran Crest, and what they did, they sit down as a group, and there's the head of nursing there. There's dietitians, there's PT, there's a pharmacist, there's anybody who's involved in patient care. They sit around a circle and they discuss each and every single person in their building, whether they are there for long-term care, or rehab purposes. They would spend more time on rehab people because they would be getting discharged. So their goal is to kind of meet their objectives and then send them out. So I really personally enjoyed this because it was the first time that I saw where people really do sit down from all fields and really discuss what's going on with the patient. Because usually in the hospitals, it's very individualized. So you have the liver doctor, you have this doctor, and they don't really collab. And this was really an eye-opener for me. I would ask the nurse certain questions that I thought were relevant if I thought I knew something. So I think in that sense, I try to be a nurse advocate to just kind of learn about it and understand how they work, and a patient advocate because I did ask the nurse a couple questions regarding the patients that I thought were valuable. So the sixth clinical objective was to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. So I think I did this a couple ways. So with the nurse supervisor, I think that really let me, I did not know what a nurse supervisor was prior to this clinical. So I really got to learn that even if, there's so many ways to advance nursing. So you could do anesthesia, nurse practitioner, but even if you decide not to go those routes, you still can have a leadership position. And this let me decide that if I don't want to go to extra schooling, or, if I have an interpersonal conflict with myself regarding work and school and family, that I could still have a leadership position as a nurse supervisor. Mind you, it has its own conflicts. So Susan was telling me how she was working before at a different hospital, and she was always on call. So it wasn't like she was there like she is at Lehigh Valley right now, where she's there from 3 to 11, and then she goes home and that's it. She doesn't answer the phone. At her old job, her job was she was always on call. So people were calling her in the middle of the night if there was call-offs, and she said that it was really like a hassle for her. So this really allows me to formulate my personal growth and a leadership that I can do this. So another one for me personally would be the Meals on Wheels that I did for community leadership. I really enjoyed this. I'm going to be honest, when I first started the Meals on Wheels, I thought it was for like a soup kitchen, kind of for homeless people. I don't know why I was under the impression like that, but then I realized it's for older people who can live at home, but they can't cook for themselves necessarily every single day, so they need extra help. And I thought this was wonderful. A trend that I saw, and I would like to continue, I actually emailed them and let them know that I would like to continue to volunteer there because I actually enjoyed it. And a pattern that I noticed with the kinds of people that were getting the food was a lot of them were on oxygen. So, oxygen expenditure, they can't do as many things without having that activity intolerance. So that was very interesting. And some people, they just got it because they're older and they really can't, go outside and go to the store. They don't have means of transportation to go buy food. So I think this is a really good service. So the seventh objective is recognize the role of the nurse in policymaking related to healthcare services at local, state, national, and global levels. Now, hands down, that has to go to the political and legislative experience that we had, because we met two people. One person who works for Lisa Bascola, and he was explaining to us the various things that he has to do in order, like the big problems that we face in nursing. So one of them is that although nurse anesthesia is considered, for us, advanced practice. It's not considered advanced practice in the eyes of Pennsylvania State. Another one is that another problem that he was talking to us about that it keeps getting pushed back is nurse practitioners cannot kind of work alone without the doctor's supervision. So they're working on something where once a nurse practitioner graduates, I think it's 3,000 hours that she can work under a doctor, and then she's free to be on her own. And then another problem that they spoke about that is related to that is the physician group is very prominent and very vocal when it comes to legislative and politics, but the nursing is very underrepresented. So we need to get a lot more nurses to get involved, and I think this was a good experience for us because we're still in nursing school, and so it's telling us right away that this is important and you can make a difference, and you need to say something. You need to be able to speak up. You need to get other nurses involved, and that's how you make change. Number 8 is predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. Now, personally, I didn't see any ethical dilemmas. However, in any clinical site, there's always potential for ethical dilemmas. So even with advanced practice nursing, so I followed a nurse anesthetist, Stephanie Williams, and with her job, there comes a lot of ethical dilemmas. So what happens when a patient can't get up from anesthesia? What happens when they don't recover and they don't have advanced practice directives? What happens? There's an ethical dilemma. It's kind of like the Terry Schiavo case that we discussed in class. Who decides? Is it the spouse? Is it the family? Is it the closest relative? What if that person doesn't have anybody? What if it's an older person who's a widow and they don't have anybody to decide for them and they don't have any kids? So there's always room for ethical dilemmas. And while I have not witnessed them, I have seen thousands of potential ethical dilemmas that could have happened. Luckily, they have not in my rotation. So I'd like to thank Professor Ducey for a wonderful semester and a wonderful experiences. I truly, really did enjoy every single one of them, and I'm glad that I got to experience this, before becoming a licensed nurse and registered nurse, and now I have more experiences and I understand more things within each field. So I'd like to thank you and have a good day.